Dr. Rosko, what do the results of these tests tell you about prognosis?
Yeah, I think this is a really important question. And I will tell in my experience, when we encounter a patient newly diagnosed with myeloma, it is like, drinking from a fire hose in terms of the amount of information that we are reviewing and the amount of information that we are discussing with the patient and with their family. And oftentimes we talk about this piece of these cytogenetic abnormalities, and we talk about, but I really encourage your patients and anyone who is listening in today to really kind of take a deeper dive, because sometimes it's helpful kind of as one, you're navigating a new cancer diagnosis, so that's challenging in and of itself. And then two, talking about a cancer, multiple myeloma, that is, most people don't know someone who has myeloma, unlike breast or colon or lung cancer. And so I really encourage patients and their caregivers, and a lot of times this happens where we'll go over all these cytogenetic abnormalities, we'll talk about, how it plays a role in their overall treatment trajectory, in their prognosis, but it's also good just to circle back and say, kind of settling in and into what this diagnosis is. Oftentimes people are started on treatment, and then even sometimes months or even years into their diagnosis, they stop and they come back and they say, can we talk about this FISH data? Can we talk about, what changes that I had, within the DNA, what does this mean? And that's not uncommon at all. So I really feel like for many people that are on the call here today, that I think it's important to say it's okay to go back to your physician and say, I'm learning more about this now that I'm more familiar with what this diagnosis is. Can we talk about these FISH changes, or can we talk about the stage of my cancer? Because I think it's oftentimes just, it's an overwhelming period of time to have a new cancer diagnosis. And I also want, just to give permission to everyone on the call to go, it's okay to go back and ask questions, even if it's been months or years. I've had many patients say, let's just go over. I said, sounds great. And so having high-risk mutations can upstage a cancer, and the absence of high-risk mutations can downstage a cancer. So what that really means is saying, these biologic changes that are happening in the cancer cells give a sense of what we anticipate the trajectory is going to be when someone's diagnosed. Now it's imperfect. I feel like cancer just generally is unpredictable, and there are many things, but we try as clinicians, and especially with the experience that we have, to say this is what we anticipate the course will be like for you. In terms of response, in terms of the cancer being quiet. As you all know, multiple myeloma is not a curable cancer right now. And for all patients, when they're diagnosed, we're often able to get disease control and be able for that cancer to be put in remission. And we do focus on remission. I think that's also something that I talk to my patients about. Even if we can't cure it, we can certainly control it. And that's a big part of what we do. So when we get good disease control, we'll talk more about the kind of next therapies. But that is how Dr. Cottini's, Dr. Cottini is wonderful scientific investigator and knows all of the latest and greatest when it comes to different mutations that are identified within cancer cells. And we partner very closely with her in terms of scientific investigations and how these mutations that we're newly identifying too play a role in terms of response to treatment and how we're able to best target them.
Okay. Thank you for that. Dr. Cottini, do you have anything to add as far as what type of questions patients should ask their healthcare team about test results?
I think Dr. Rosko already pointed out the most important thing. So multiple myeloma is a rare disease, and it's not as intuitive to understand as breast cancer, lung cancer, prostate cancer, because so it's really important as a patient to understand which test are we ordering, why are we ordering, how do we monitor the disease, because that's one of the most important questions that patient asks. Because for different type of solid tumor, we get imaging and we know if the tumor is growing or not. While for us, we look at the marker that I described previously, and sometimes we maybe see small changes of the markers that are very concerning and worrisome for the patient, but sometimes they are not. So I think asking questions about the testing and how we treat and monitor the disease is an important part of being a good advocate for itself.